from IBW, from pipe fitters, from a number of unions that came down to speak against that. We were able to stop that from passing. I have a bill that's coming up soon that will require the utilization of apprentices on any construction jobs that the state does that are over $500,000 that do not use federal dollars. And why that's important is that we spent a lot of money a couple of years ago in workforce initiative programs to get these apprentice programs going. But if we're not using them on jobs, then they're never going to get the time in their trade in order to be able to go and test and become journeymen. So it's sort of putting the state putting the money where their mouth is, that if we're going to do this, then we need to make sure that apprentices are utilized. So that one will be coming soon, and then another one that I'm doing would create a cooling off period for people that are put into a 3-day hold. If there's a fear that somebody could endanger themselves or someone else, they may be placed into a 3-day mental health hold. If they had a weapon, like if they were threatening to kill themselves and flashing around a gun, if they get, police are called, the gun is taken away from them already, this current law. It's taken by the police and then they get put into the 3-day hold. If they get released, because sometimes maybe they were just drunk or something else, they're not really, they're just an emotional crisis going on. If they get released, then they run down to pick up their gun. And the police, they know something's going on with them. They don't want to just give them the gun to just go back and do whatever they were going to do before. So it gives the discretion to the sheriffs to say, I'm going to wait up to 10 days before I give you your gun back. And maybe you'll go talk to somebody, but more importantly, it might allow family members or significant others to go and get a restraining order if they need to. So that bill will be coming up soon as well. And I think the biggest bill that's coming up is going to be Dominic's bill that comes up tomorrow. He will tell us about that. No, not tomorrow, on Monday. But they'll be getting ready for it tomorrow. So I'll let Dominic tell you about that one.
Good morning. Unlike these two lucky ladies who serve in the majority, I'm in the minority, so most of my bills are dead or might be dead soon, including the one tomorrow probably, unfortunately. But I've been very busy on the Joint Budget Committee. I serve there, and I'm one of 6 people who has the responsibility of balancing the state budget each year. And we just finished closing out the state budget this week. It'll be heard in the Senate next week and the week after in the House. And I'll be honest, it's not a great budget. And it's partially because of, it's mostly because of the fiscal constraints that the state of Colorado operates under. And I'm going to go into those, all those different constraints maybe after our presentation and have a broader discussion about our budget and what we can do to make it better. But this coming Monday, I do have a bill in committee. It's in the Senate's State Veterans and Military Affairs Committee, which is the KILL committee. But it would be about allowing folks who are transgender to update the gender marker on their birth certificate. These are folks who, it is a painstaking and painful process for them to undergo the gender transition process, and at the end of that, they never even get their government documents to reflect who they actually are. And so I'm working on that issue. It has been introduced the last 2 years and died both years. It'll likely die again this year. But hopefully, I'll do my best, and I'll do my best to persuade the committee members that this is valuable legislation and would make a difference in the lives of many people. But with that, I want to go ahead and turn it over actually to our presenters. And I feel so badly because given the recent news, I'm sure they were scrambling, being like, oh my God, we're going to tell these people, considering that that bill is now not going forward for the time being at the federal level. But I'm sure they're going to have some amazing insight into what maybe comes next after that. And so I will turn it over to them and very much thank them for being here. And real quick, Richard, yeah.
Before we start the presentation, I'm disappointed that we're halfway through the legislative session and I have yet to see a status of bills at our town hall meetings. You know, I think that's very important, because that tells me where the bills are in the process. I think that's valuable information. So perhaps at the next town meeting, we will have a status of the bills.
We will make sure to bring that. All of our legislative aides are in the audience, so we'll make sure they know to bring the status sheet of all the bills for the next town hall. Thank you for pointing that out. We're going to go ahead and turn it over to our presenters. Thank you for being here.
Thank you. I'm Joe Hannell. I'm with the Colorado Health Institute, and my colleague here, Ian Pelto. And I've been with CHI for about 3 years. Prior to that, I was a newspaper reporter for the Durango paper, covering the state capitol. So I've been around the Capitol for a dozen years or more. Colorado Health Institute is a nonpartisan research institute. We don't lobby for any health policies. We don't really take positions. What we'll do is look at proposed legislation and look at bills and laws that have already become law and evaluate them and see how well they're doing or how well they might do. And the whole goal is to just get information in front of your state lawmakers and you, the voters, on what are the potential consequences and benefits, so you can make an informed choice based on what your own philosophy, morality tells you. But at least you'll have the numbers to know what's likely to happen. And that's what we did with the American Health Care Act. And I put this presentation on a USB drive, ran it over to Sophia, Representative Michaelson, Jenet's aide, yesterday about 12:15, and then 3 hours later, I was sitting watching C-SPAN, and all of a sudden, it's just over. the bill is pulled, and I thought, well, they didn't vote on it. Maybe the bill's still alive. And then a little later, I see the Speaker of the House have a news conference, and he said, Obamacare is with us for the foreseeable future. So that means the 60-hour weeks we've been putting in to analyze this bill are, it means you might be the last people in the world to see this presentation. So, we create, even though this bill is gone, we think the whole issue, the Affordable Care Act, whether to repeal it, whether to change it, that's still with us. It's very much in flux. So we've created a team of analysts to really tackle this at the beginning of the year. And I think it's maybe worth still seeing this presentation because the bill that was created didn't come out of nowhere. These are ideas that have been kicking around in conservative circles for 20 years. Certainly it's something that Paul Ryan has been talking about for really since the Affordable Care Act became law. They're talking about changing Medicaid, creating high-risk pools, using health savings accounts, more individual responsibility over healthcare costs, less kind of government backup. That's the whole philosophy behind it. That's going to be with us. So when we go through this presentation, you see what the AHCA would do, the American Health Care Act would do. You can just kind of think of that as what conservative proposals would do. And there are probably, I'm sure there will be ways that they're tweaked in the coming months and years, but this is still, it's still very relevant. These are the ideas that have bubbled to the top on the right. So, first of all, kind of 3 points of the presentation. Under the Affordable Care Act, more than 500,000 Coloradans, we count, gained insurance. That was, and it happened it didn't happen across the board. It happened to some specific groups that we'll get into. The second, this needs to be changed now. A bill has been introduced. A bill has, it still was introduced. We're kind of switching from future tense to past tense here. That would cut Medicaid and rearrange tax credits. Those are the two big policies among it. The likely outcome of that would have been that younger people, healthier people probably would have saved some money under it, while older people and people with higher health needs, people in rural areas would have ended up paying more. And that is probably we weren't the only ones saying that. That really got out into public and into the whole discussion in Congress. That more than anything is probably what sunk the bill, is that older voters, not people but voters, and people with who already had high health costs would have been paying more. That was viewed as unfair, and that's probably what took down the bill as much as anything. So I'd just like to start out with talking about why insurance matters. And I said, CHI, we don't lobby, we don't take positions, but we do have a point of view that we've arrived at over years of studying how people get healthier and how the whole country gets healthier. And really, the first step in that is getting insurance. Getting insurance unlocks access to care for people. We see people without insurance tend not to go to the doctor. And it's not because they're healthy and they don't need to go to the doctor. There's a small subset of people who they can get away without being insured because they're marathon runners, eat kale for breakfast. But for most people who are uninsured, aren't going to the doctor, it's because they can't afford it. Once care has been accessed, then people can start to learn how to use care wisely. They can start going to their primary care doctor instead of visiting the emergency room when things get really bad. They can start to kind of take ownership of their own health and stay healthy rather than getting sick and trying to get healthy again, which is really expensive and really tragic often. And then finally, you can arrive at better health care at a lower cost, both for people, for their insurance companies, for the state government, and for all of us together in society. That's kind of the progression that we've seen. So we're focusing on that, what the Affordable Care Act focused on, and what this latest bill focused on was step one, getting insured. All the rest of the stuff was kind of incidental to the conversation. We're still stuck at step one. But as I'm going to show you, the last few years we've made quite a few strides in getting to step one. We count 570,000 people who get coverage benefits in Colorado through the Affordable Care Act. Most of them probably would have been uninsured without it. So that's 1 in 10 people who owe their insurance basically to this law. About 465,000 through Medicaid expansion, and then another 100,000 on Connect for Health Colorado. These are the tax credits. It's the second part that gets all the attention. Whenever you hear people talking about Obamacare, they're talking about private insurance and tax credits and the exchange and how the website crashed and all that. It's the first part, Medicaid expansion. That's by far and away the most important in terms of covered lives and in terms of money coming into the state from the federal government. It's 4 or 5 times as big in Colorado and in most other states as the part that gets all the press. So we were really viewing this as a discussion over Medicaid expansion and the future of Medicaid, which is for your state representatives, for you as taxpayers, and citizens of Colorado. That's the big deal. It's a little dim here, but we take a survey every couple of years called the Colorado Health Access Survey, and it's not a cheap survey. It's 10,000 people, and we can really get good data all across the state on who's insured, who's seeing the doctor, who's saying they're healthy and not. In 2013, the blue bar on the far end shows almost 14.5% of people in Colorado were uninsured. By 2015, that had dropped to less than 7%, so we more than cut the rate in half. And that happened through the orange bar, kind of in the middle there. That's Medicaid expansion. What the Affordable Care Act did was allowed states to expand Medicaid mostly to childless adults who make less than $16,000 a year. People at lower incomes, who were parents, kids, pregnant women, disabled people needing long-term care, they've been covered already, but this allowed a big expansion. And the federal government, for the first few years, picked up the entire tab, and they're still picking up around 95% of the costs. And the ACA's expansion really helped certain groups, as I said. It wasn't across the board. The first group that it helped was younger people under the age of 40 in general. They were the ones who showed the biggest gains in their uninsured rate. And it's kind of small and gets lost on the left there, but kids, actually. The child uninsured rate in our survey was down to 2.5%. So that means it's really hard to go through Colorado and find a kid who doesn't have insurance. And that's just a huge victory that we don't hear people talking about all that much. There wasn't anything specific in the Affordable Care Act, but what was happening was that as adults qualified, as a larger group of adults qualified for Medicaid, they found out, oh, we can get our kids on this other insurance, or you know, other family members, they learn about it. The word just got out, and kids got signed up. And the other group that really helped were people making roughly less than $35,000 a year. This is where the tax credits were concentrated. Both Medicaid expansion at the lowest end, and then for the next few groups, those tax credits that really helped out people making, you know, $35,000, $40,000 or less. Once you got above that, there really weren't all that many changes in the uninsured rate. That's because it was already a pretty low rate to start with. When you have money, it probably means you have a good job, and that probably means you have insurance. But the ACA helped out this group kind of on the left there. By geography, it was it's really kind of a rural story, actually. The little blob in the middle is Denver County, and Medicaid expansion was really big there. But where it was biggest as a proportion of the county's population is in the San Luis Valley and southeast Colorado. Senator Moreno, one of his colleagues, a clearer version of this, and we've got it online, actually. I see a few people taking pictures. I'll give you a website where you can get this presentation. This big dark purple blob at the bottom is basically all one Senate district. It's covered by a Republican named Senator Larry Crowder, and he's very much in favor of Medicaid. That shows you why, because in his counties, up to 1 person in 5 is covered just by the Affordable Care Act expansion. He has some counties where 40% of the county is on Medicaid, both the ACA expansion and prior. Do you have a question?
I just had a comment. One of the arguments they were putting forth was we want people who are on Medicaid to be working, but the people in the expansion, by definition, were making more than the minimum poverty, so they were the working poor.
Yeah.
And that's a really important piece.
Right. There was a proposal, though it never got on the bill, to institute a work requirement for Medicaid. And we didn't do the study, but some national groups had looked at it, and close to 90% of people in that Medicaid expansion either were already working or were working as at-home caregivers for other family members. So it wouldn't. There's a bit of a myth about who the Medicaid population is. I know someone on Medicaid who has a PhD, and she's had debilitating migraines and can't work. But also, it's a condition that doesn't quite qualify for disability. So, Medicaid is part of the social safety net, and a lot of folks on it are actually working or trying to work. this is a map of those tax credits. And the darker regions here are, my shorthand for it is, if the county has a ski resort in it, then it's probably a lot of people on Connect for Health Colorado getting subsidies. This is where you'll find some of the highest insurance prices in the United States. And it's for a variety of reasons that we're trying to look into. But what the Affordable Care Act does is when the insurance prices get really high, the subsidies get higher. And we'll see that's important when Ian's going to talk about what the bill that basically died yesterday would have done. It would separate the cost of insurance from the tax credits you get. So it's no surprise that when your insurance prices are super high, the tax credits also are really high, and you've got a great incentive to go and use them. I mean, some of these folks are getting tax credits of $8,000 for their family. So very popular out there. Not so much here in Adams County. Some local statistics here. There are 38,000 adults in the Medicaid expansion in Adams County, in the Affordable Care Act's expansion. A sizable part of the county, but not as much as in some rural areas. 5,500 people here are receiving tax credits, about 1% of the population, but still 5,500 individual people. In Medicaid spending in general, not just the expansion, but Medicaid spending in general, $700 million coming in from the state and federal government. That's, your tax dollars that are going out and they're coming back in terms of Medicaid spending and benefits. And then the uninsured rates. In 2013, there were 75,000 of you and your neighbors who were uninsured, above the state average. And now in 2015, in our last survey, that's down to 31,000 people, right about the state average, 7%. We have a new survey that's in the field right now, and it'll come out in September. It'll be interesting to see how it works. I think probably you'll see the numbers drop even more. So I'm just about done with my part of what's at stake when we're talking about federal health reform. First of all, the federal government's picking up 94% of the tab on Medicaid expansion right now. There were proposals to drop it to 50%, which is what the normal Medicaid match is before the Affordable Care Act. If that would have happened this year, it would have been $907 million that Senator Moreno would have had to find. And he's sadly smiling right now because finding $7 million is really difficult. Finding $907 million, that's more than the state of Colorado sends to every college, community college and university every year. So even if you would privatize all of higher education in Colorado, you'd still be looking for money to cover this. That is to say, federal funding for this Medicaid expansion is crucial. Now, here's a slide that really needs updated. We've got some news headlines. It's moving fast. It was.
Can we just skip this part?
Yeah.
Seriously, it's
Yeah.
I mean, today something this morning, tomorrow be something else.
Yeah. Well,
Just move it along. I'm gonna get away ADHD. I'm bored now.
well, I think it's important, actually, to know what's going on and what was going on. I know that this is 15 hours ago, that it's so yesterday, but the idea is still there. Most Republican elected officials in Washington campaigned and made a promise for the better part of a decade to repeal the Affordable Care Act. I don't think you can say that just because they didn't make a vote yesterday, that's going to go away. And I don't think you can say that, and you can't say, well, the Affordable Care Act's here, it's perfect, and now we can talk about some other issue. We see tremendous flaws in how the Affordable Care Act is functioning, and those will still be with us, and the impetus on the right to repeal it is going to still be with us. Yes, sir?
But they did say that the act needed improvement, okay?
Yeah.
But throughout the nation, there's different needs in different areas.
That's
And
exactly.
I think what the communities need is what are improvements and what aren't, so that they can compare one against the other when things like this come up.
Yeah.
And they all look at okay, how can we get this and improve it?
Right.
Depending on each state, okay?
Exactly. And what we've what you're about to see from Ian is a look at where the improvements would have been and where the backsliding would have been. And that's what I've tried to set up right now is where are the pressure points in when we're talking about changing the Affordable Care Act. So in Colorado, it's our Medicaid funding. It's people in rural areas, people with lower incomes, younger people. Those are the folks who are, and actually older people as well, through those tax credits. Those are the populations that are at risk when we're talking about changing the system. So when we're talking about going forward, it's not going to be the American Health Care Act, it might be something else. It's always, that debate's going to be with us. Keep in mind those populations. Sir?
Yes, can you explain the 400 richest people who are receiving tax credits?
I'm sorry,
You talked about the 400 richest.
oh, yeah. You know what, let's, Ian's going to get to taxes under this bill. And Representative?
In the news yesterday, they were defining which groups of Republicans would have voted no, and you pretty much have them aligned.
So there's
If you could talk about the three groups and then use the names that the media used.
Sure, yeah. This you might have to help me out with that.
The Tuesday.
Oh yeah. Okay. Right. Yeah. So there's this is my second to last slide before I get to the end. These groups still exist. This is kind of the Republican split. There's not just a Republican Party. There are several groups within the Republican Party, just like there are several groups within the Democratic Party. This slide is basically why the bill failed. I have senators on here because at first they were the ones who were the most out front. Lamar Alexander is kind of on the left of the Republican Party, it's relatively speaking, but he was saying repair instead of repeal. On the right was Senator Rand Paul and the Freedom Caucus you heard so much about. Their votes kind of sank it. They just wanted the bill repealed. They didn't want this replacement that the Speaker of the House came up with. Lamar Alexander was his kind of, in the House, his allies were called the Tuesday Group, I think. It was a new one on me. But they were what these groups were concerned about. On the left of this slide, they were concerned about coverage and access and consumer costs. On the right, it was more philosophical opposition to offering tax credits, to offering government assistance programs. And the Speaker had to balance between those, and he was trying to simultaneously move the bill to the right and to the left at the same time. If anybody's tried to do that, it's physically impossible. And that's why the combination of opposition from the left and the right is what really sunk the bill. The imperative for the Speaker and for a lot of people who were the majority of his party that was on his side was, we promised people we were going to do this, and that promise can't be taken back, so there we go. And then the president was very strongly in favor of this at the end, but we didn't put him on the slide because he's really hard to pin down. These are quotes. He said, this one, there was a philosophy in some circles, if you can't pay for it, you don't get it. That's not going to happen with us. The bill, as you'll see in a minute, would have done otherwise. He said he wasn't going to cut Medicaid. But then he did come out 100% in favor of the AHCA, and then if you won't get it by the end of this presentation, when you get a t-shirt made up with this, nobody knew healthcare could be so complicated. I should have, he should have told me before I took my job at CHI. It's fantastically complicated, and every time you move one little thing, it squeezes somebody else. We have, so what we, I was going to have to say the former plan, you can just kind of think of this as the philosophy now that's animating Republicans on the right. And for this part, I am actually, Ian is going to walk you through and think of this as ideas that have been bubbling up for years, that found its way into a bill that died yesterday. The bill's dead, the ideas are alive.
So as Joe mentioned, I'm Ian. I've been working at CHI for about 9 months now. Fresh out of college, but I'm a research analyst. And I didn't know it at the time, but I drew the short straw and I'm presenting on something that doesn't exist anymore. So that's fine. But as he mentioned, all these points, these didn't come out of nowhere. These have been Republican ideals for about 20 years. And I've read just about every plan that the Republicans came out with this year, and this has sort of been a boiled down version from every one of those. So I'm going to talk about each one of these points a little bit more briefly than I would have, because obviously the specifics are going to change a lot if this bill, or if any bill comes from this, but they're important points to consider moving forward. So the AHCA, which, again, if they do anything, they need to change the name, because AHCA versus ACA is driving me nuts. But two major issues, as Joe mentioned, Medicaid, and it would have changed it in two ways. One, the Medicaid expansion population would be dramatically changed, and two, it would change how we paid for it, and this is what would give Senator Moreno a lot of points. But a few more points. We would offer age-based tax credits instead of income-based, and I will get to that as soon as I get through these. And it would make insurance cheaper for young people and a little bit more expensive for old people. And that's by changing the age rating ratio that's right now 3-to-1. It would change to 5-to-1. And finally, what we thought would never happen, but it would actually sort of indirectly affect Medicare. So to start with Medicaid. As Joe mentioned, Medicaid is the biggest question moving forward with just about any Republican plan, both in terms of covered lives and money. Every one of the yellow states up here expanded Medicaid through the ACA. If you look at them, they're not all blue states. There are a number of red states up here with Republican governors who are definitely pressuring their federal counterparts to oppose the AHCA. And this would be my guess as to at least part of why the AHCA failed. And that's because about 90% of Medicaid funding for the expansion population comes from the federal government. And that's hundreds of millions of dollars. In Colorado for this year, if we drop that population, they said it would be $907 million that we would have to come up with. So the billion-dollar question, the eligibility expansion. Again, the Republicans have been wanting to change this for years. The Freedom Caucus wanted it gone yesterday. Others were a little bit more hesitant, even within Colorado. The AHCA would have changed it so that as soon as 2020 rolled around, anybody who cycled off of Medicaid or who tried to come onto the Medicaid expansion population would be unable to receive the federal match that's the 90-10 match, and would instead be reverted back to the 50-50 standard Medicaid population match from the federal government. Unfortunately, this actually happens a lot. You'd think that, oh, anybody who's on Medicaid now can stay on Medicaid. It's not a big issue. But about 1 in 5 Medicaid enrollees cycles off of the program every year through what we call churn. And that can happen for any number of reasons. Your forget to fill out your paperwork, you cease to be pregnant, your income changes a little bit. So that compounds pretty quickly, and eventually there would really be no expansion population left because the state really couldn't pay for it. The other way is how we pay for it. Again, the federal government currently pays about 90% of the Medicaid expansion population. That's anyone between 100 and 138% of the federal poverty level, so anybody under about $16,000 a year. And then the standard Medicaid population, we get a 50-50 match. So this would change it entirely. The per capita cap would give the state a set amount of money based on a 2016 standard for each Medicaid enrollee. The state would have the freedom to sort of decide who they wanted to enroll up to a certain population. But again, if they tried to cover an expansion population for which they would not receive the federal match increase rate at 90 to 10, you really couldn't pay for it. And again, it would grow at medical inflation, part of the CPI or the Consumer Price Index. So this slide, oh, he's gone now, but would give Senator Moreno a heart attack. According to our analysis, the first year wouldn't be that big of a difference because it's all based on a 2016 standard. The per capita rate would only notice, well, I say that, it's only about $340 million. But this quickly grows, and note this is in billions. So over the first 10 years of the program, Colorado would have to fill a hole of about $14 billion. And then the biggest question for who's enrolled in Medicaid, over the first 10 years, we actually estimate that about 600,000 fewer people would be enrolled. And that's mostly because of people cycling off because we can't afford to cover them. So the green line here, oh, I should go back, sorry. The purple line on the top, the darker purple line, is the status quo. That's if the ACA continues unabated as it may well now, I'm not really sure. The purple line represents what the AHCA would have done and would have really decreased how much funding we were getting from the federal government. On this one, the green line again is the status quo. This is if the ACA continues. It would continue to be about a quarter of our state's population. The blue line is the AHCA, and that's as people started to turn off of Medicaid, they would not be able to re-enroll, and the state would not be able to pay to keep them enrolled. And then the red line is sort of what the Freedom Caucus was hoping for, really, and that's to drop the Medicaid expansion population yesterday. So move on from Medicaid, private coverage would also change dramatically. To get to your point, right now, anybody up to 400% of the federal poverty level, getting exactly $50,000, can receive a tax subsidy or a tax credit from the, through the exchange that's connected around Colorado to help pay for their subsidies. So in addition to basing it on your income, it's also based on where you live. So a plan might cost $2,000 here in Denver. It might cost 4 times that out in the mountain regions. So it's based on a plan, and as Joe mentioned, it scales it to that level. So you're getting a higher tax credit to bring the level that you're paying down to about what anyone across the state would. The AHCA would have completely removed all the geographic rating regions, but also the income variable. So it would base it on your age. This means that somebody my age would receive about $2,000 a year, and older folk between 50 and 64 would receive $4,000. And again, that's the only thing that it would be based on. People in the mountain regions who are paying a lot more for their health insurance would not receive a higher rate like they were with the ACA. Should I move that back one? So to go along with the tax credits, the age rating is the how much insurers are allowed to charge somebody for their plan. So right now the age rating ratio is 1 to 3. So a younger person or an older person can only be charged 3 times what the youngest person is. That would be changed to 5 times under the AHCA. To give you an idea, this is from the RAND Corporation. Under the ACA, these are pretty average premium costs. If you're younger, you're actually going to end up paying less, or would have ended up paying less under the AHCA, but an older person could pay a significant amount more. And then to go back a little bit, the individual mandate replacement, this was the toxic thing about the ACA that Republicans hated so much. This would probably, it's the mandate that everyone receive coverage or purchase coverage, and you would either have to pay a penalty of $645, I think, or 2.5% of your income, whichever is higher, if you decide or if you elected not to purchase insurance. And that was to help stabilize the market. Yes.
Do you have any statistics on how many people in Colorado were paying that penalty?
Unfortunately, we don't. It's something I'd like to find.
Yeah, numbers like that are
There's
notoriously hard to
national
find.
stats that
Yeah.
we can look up. We should know that.
Really come from people's tax returns, unless they respond to information prior period.
So this toxic part of the ACA would be replaced with what we're calling a continuous coverage clause. That means that if ever you dropped coverage for more than a month in a year, if you tried to re-enroll again, your insurer could charge you up to 130% of your average, or of your standard premium cost for the rest of that year, or for a year after that. And that's to incentivize people to maintain coverage and try not to game the system. So that's when people would get sick, buy insurance so they don't have to pay the full cost of it, and then drop insurance again once they're better. So here's what that would look like, the tax credits on a statewide scale. And it's hard to see, but it does go all the way out here. The regions in red would actually receive a higher tax credit than under the ACA. And that's because our premiums are generally lower here in the Denver area. But if you look at all the blue around here, in the more rural areas, they would receive a lot less, and that's because the cost of their premiums are already a lot higher. In Adams County specifically, the ACA premium after your tax credit, about $2,500, you save about $1,000 on the AHCA. And again, that's because there's no regional rating for the tax credits like there is under the ACA. Medicare. So to move along from private insurance back to the public world, we heard this, I think, just last Monday. This sort of idea of Medicare is already kind of on thin ice. And Joe came up with the idea of a polar bear. The ice is getting thinner, and the AHCA would have increased that rate a lot faster. And it doesn't directly, the AHCA would not directly affect Medicare, but what it would have done is make a significant tax break for high earners, anyone over about $200,000. And that tax break under the ACA is used to fund the Medicare trust fund. Thank you. Now, this has been sort of revised over and over again through a number of managers' amendments. Originally, they were going to drop the tax entirely, immediately. Under the most recent one, they decided they're going to drop it in 6 years. But basically, bottom line, it would accelerate the trust fund insolvency by about 3 years, one way or another. But it would also increase expenses, and that's because anyone who does not have insurance, who needs to go access care through EMTALA, which is, I won't go into that. If you need care and you don't have insurance, you can go to the ER. They're required by law to treat you. And the way the federal government pays for that is what's called a DSH payment, or disproportionate share hospital payment. Under the ACA, those payments were dropped significantly because more people had coverage, more people could pay for the care that they were getting. This is sort of to combat the increase in the uninsurance rate that was expected under the AHCA. This would increase the DSH payments again, and that would also come out of the Medicare Trust Fund. But it would not directly affect Medicare benefits. So a couple other features. I won't spend a whole lot of time on any one of these because, again, this doesn't exist anymore. The specifics will probably change. We cut just about every tax that the ACA instated, which is sort of run-of-the-mill Republican politics for what we expected. Defund Planned Parenthood. Again, it didn't mention it by name, but if you read the bill pretty closely, it's obvious that this is who they were talking about. A very interesting one that Joe and I have been looking at a lot is the $100 billion for state innovations. This is a fund that we haven't really seen before, and again, it's for innovations. They would be provided to states. I think $15 billion would be distributed to all the states, not every state individually, but would be split up amongst the states for the first year, second year, and then after that would be $10 billion. And the states could really do what they wanted with it. And that, to your point about how every state needs its own touch, like you can't cover all these with a broad stroke. This is interesting moving forward. I expect that we'll see this coming back because states really do need to, I don't know, I guess, have
Yeah, here in Colorado, we really need to kind of shore up our individual insurance market. There's bills in the legislature to do that, but it's really expensive.
Right. So, for instance, increasing the income bracket. So, right now, anybody below 400% of the federal poverty level can receive tax credits. Increasing that to 500% is something that would help folks on the western slope specifically. That's a bill that's been introduced. But again, how do you pay for that? So, this is interesting and will likely come back. Again, we won't really go into many more of those because it doesn't exist anymore. So the story is not good for rural Colorado under the AHCA because of the lack of regional rating areas for the tax credits. As Joe showed you with that blue map, those regions receive higher credits and a lot higher percentage of the population receive those. The AHCA was off the table, the geographic rating areas, the cost of healthcare was really not addressed. It addressed who paid for it, sort of poked the bubble in, or poke the balloon in, comes out somewhere else. But really the cost of healthcare was never addressed. So, to sort of wrap this all up, we had a presenter named Sarah Cliff who came to our conference last December, and this was before the AHCA, before a lot of Republican plans had been released. She did a really good job of summing up all of, even this one. But it's basically that Republican plans cover fewer people than the ACA, are generally better for people who are young, healthy, and higher income, and worse for those who are older, sicker, lower income, and I would add rural Coloradans to that as well. So, this slide has been in here long before we understood that the AHCA was not going to survive. But the Republicans, they really do have to own whatever they replace the ACA with. And that's why Democrats really haven't been on board with any one of these. They've sort of taken a step back and said, we're not going to be a part of any negotiations. This is on you. If you're going to replace the ACA with something like the AHCA, you need to own it. And they didn't want to be a part of that. Understandably. I mean, the CBO report reported that about 24 million Americans would lose coverage under the AHCA. And again, to go back to the Medicaid expansion of those yellow states on the map, Republican governors, I think, were really pressuring their federal counterparts, and that definitely helped them to kill this bill yesterday. And then again, within the GOP, the Freedom Caucus on one side and the Tuesday group on the other, I mean, Trump can blame the Democrats all he wants. It was even within its own party that there was really not a whole lot of consensus on this bill. So, I'll leave you with 3 takeaways. This is probably the most important one because the AHCA is now dead. The stakes, 500,000 Coloradans could have potentially lost coverage under the AHCA, mostly through Medicaid. This would have happened, not anymore, won't cover that. But the likely outcomes, we can't talk about anymore. we do a lot of conjecture. I'm sure that's what we're going to be doing in the next couple weeks. But at this point, with the AHCA now dead, we're just sort of moving forward, same pace you are. We left yesterday, or last time I saw Joe, this was still sort of on the table, and now it's not. So, again, you're probably the last group to ever see this presentation. Congratulations.
Number 2 up there.
Oh, yes.
They can still change Medicaid into block grants. an idea they might want to do that.
Yeah, that's very true. One possible, it's time for us to start talking about what comes next. And Paul Ryan has been talking for years, since he was kind of a junior congressman, about let's convert Medicaid into block grants, or in this bill that he had discussed, the per capita caps. Instead of giving a dollar for dollar match to states, you have you just give them a set amount and you grow it by inflation. And if medical costs grow more than that, then that's on the state. We did a study that showed that would result in a $14 billion fall. And actually there was a national group just yesterday that came out with a study that had nearly identical projections for Colorado. So turns out our analyst was on the ball when she did that. So that's one of the proposals that still is, I don't think just because this bill was pulled yesterday that Paul Ryan suddenly decided he doesn't want to block grant Medicaid. I think that's one of the animating features of what he wants to do with his majority. The slide that we never had a chance to make now is what comes next. What can we work on? Well, Ian mentioned that stability fund. There was a question back here about how it's different in different regions for different states. Yeah, Colorado's challenges are different from New York's and different from Louisiana's. That stability fund was really kind of cool. It would let states decide where their needs were. Maybe there's, once the fires simmer down, there could be some bipartisan agreement on something like that, because Colorado could use some shoring up of its insurance market. Sir?
My question about the innovative fund is Colorado's antiquated tax and budget limitations would put us in a situation where we couldn't even, if we spent money on that, it would take money away from
Tabor? Possibly, although there's probably taxpayers' bill of rights says that when you get money coming in, then
you mean the most restrictive budget tax limitation?
Yeah, it is. Yeah, Colorado Taxpayers' Bill of Rights, as Senator Moreno well knows, is by far the strictest tax limitation of any state, and we've had it since 1992. Correct me if I'm wrong, there'd probably be a way to design federal grants that would fall outside of the Tabor limits.
Yeah, so any money that comes in from the federal government actually is not subject to Tabor. So it would fall just outside the scope of that.
But in this case, they were asking for state innovations on how the money is spent. And there is already a state match. Wouldn't that state match then have to go up? And where does that money come from?
The state match would, exactly. We don't know where the money would have come from the state match. This is actually a perfect segue to talking a little bit about the state budget, and then we don't have much time left, so I want to make sure Representative Michaelson, Jenet, and Benavidez get a chance to talk about any issues through the House, but please help me thank our presenters for
We will get to your representatives our website if you'd like this presentation and a whole lot more. We have it on the website. We'll give you a link. I had handouts. They're in the front seat of my car. I drove my wife's car today. So sorry about that.
Thanks, Joe. So we're going to go ahead and transition just to some of the legislative issues that are going on right now and answer your questions, anything you've seen in the news, anything you've heard about, that you want more information. I also want to make sure that we recognize some of the other elected officials in the room today. We have Mayor Pro Tem of Commerce City, Renee Bullock, here. Commerce City Councilman Steve Douglas is here. And my colleague in the Senate, Senator Andy Kerr. So I want to talk just a little bit about the state budget because it's very fresh on my mind, considering that we just closed it out this week. And it was a really difficult year to try to close the budget because there were some serious financial limitations on our ability to meet the demand that our residents expect of government services within the available revenue for next year. Wednesday we were there. We finally made a bunch of decisions and were able to close out the state budget for the most part at 11:30 p.m. And we were there for all day talking about the state budget. And at the end of it, a Denver Post reporter came up to me and said, "Okay, now that you've done all this, what do you actually like about the state budget?" And I actually struggled to answer him because we're in such a difficult year. But a couple of highlights that I think people would appreciate. One is that we were able to keep the senior homestead property tax exemption intact. So seniors will still get their property tax exemption. For me, it was really important that we not balance the state budget on the backs of seniors. And so we were able to not do that. The other was we allocated $20 million more to higher education to try to keep tuition low. So that was a really big win as well. But there are some really difficult cuts that we had to make. One is through the hospital provider fee. The hospital provider fee is a fee that hospitals pay. They willingly give it to the state so that we can match it with federal dollars so that they can come back and use that money to serve people who come to the emergency room if they don't have insurance or if they're low income. They use those funds to do that. But the hospital provider fee is a cash fund that counts against our Tabor limit. And it is a very large cash fund. And it is largely the fund that has pushed us over our state limit, our Tabor limit. And so we made the decision to cut the hospital provider fee by $264 million next year. Now remember, that's money that those hospitals use to match with federal dollars. So the impact is twice the amount. So hospitals next year are facing $500 million in cuts. And this was really tough. It is going to affect rural hospitals the most. And rural hospitals have said, we cannot sustain this cut. If you do this, we will close.
Dominic, wouldn't it kind of, if Obamacare stays reasonably intact, for lower health costs, not that, wouldn't the fact that there would be less uninsured, that the hospitals would not be taking such a brunt?
Yes. So a couple of things there. Yes. Usually now that you saw the numbers, because of the Affordable Care Act, the uninsured rate is a lot lower. But hospitals also had to increase their demand. People now have Medicaid, so they are utilizing health services more often. Especially in those rural areas, you saw the map where most of the people Medicaid's benefited the greatest. Those folks are now actually more willing to go get health care services because they have insurance. And so hospitals have been struggling to meet that competing demand. So rural hospitals are really facing a cut based on what we did. But it was done to put a little bit more political pressure to find a solution. And that's been successful. On Monday, we're going to see a Republican senator from the Eastern Plains, Jerry Sonnenberg, introduce a bill to classify the hospital provider fee as an enterprise and to remove it from the Tabor cap. Because he knows what it means for his community. And so hopefully that's going to go somewhere this year. We also cut the transfers that we were expected to make towards transportation projects. Now, it's not because we don't value transportation and we don't know that there's an incredible need for our transportation infrastructure. It's again because there is another bill making its way through the process that would increase revenue for transportation. And so it was meant to put pressure on folks to say, hey, there's this other bill. Can we please get some traction on this and pass that bill so that we don't have to make the difficult choices of every dollar we put towards transportation comes from schools or comes from healthcare. And so that's the budget and why it's constructed the way it is. We managed to keep funding for critical government programs in that budget, which was great. One of the things I'm really proud of that I was able to do as a member of the Joint Budget Committee that will never get any media attention, but I was able to increase the number of postpartum depression screenings for mothers who qualify for some of our programs. This is a bigger conversation that we're having around integrating mental health with physical health, because they are absolutely linked. But we don't always realize that. And we don't always make sure that when people come into the doctor's office that we're asking, how you doing? How you feeling? And so this will, the next stage of the Affordable Care Act, the next stage of Medicaid in Colorado will be integrating behavioral health and physical health, which I think is long overdue.
I'd like to point out that a constituent reached out to Senator Moreno, and he was able to respond to that constituent who said, hey, we've got a problem in our community, and he found a way to do that. And we don't often give our representatives enough credit for that, so he really deserves a huge hand for responding to it.
But I know you probably have a lot of questions about what's going on at the Capitol, so I want to open it up to your questions, or I don't know if you guys want to.
Let me just say one thing on the budget. This is new for Daphne and I. It's our first year, but what was explained to us, the budget will get introduced in the Senate. They will make some amendments to it, and then when it comes to us the following Monday, then we will look to make amendments, and we'll have several late nights. The Senate will be there, and then we'll try to look at what both sides are doing. One of the things in the budget that also was limited is only $5 million was set aside for bills that legislators may come up with. Usually that's more like 10 or 15 million. So a lot of the bills that pass, if they had a fiscal note, are probably going to go away even if they passed. And there'll be some negotiation on that, but from a much limited pot of money involved. There's, just as far as other bills, a couple of important bills that are coming to some committees I sit on in finance. We'll be looking at the transportation bill, and that's to add a sales tax increase to cover transportation costs, and that'll be coming to finance committee this week to get it through to our committee in finance. And then we have a couple of bills in state affairs that are on construction defects that I know all of you have heard about. One bill, 156, there's been a lot of discussion by particularly some mayors in different communities. But I don't know personally if there's an answer to construction defects, but that bill does not have support from both sides of the groups on construction defects. There will be another bill coming, 1279, that does have support from all the groups under construction defects. So that one we're hoping may pass since everybody's in alignment. But those will be coming out this session as well. But I don't know if you want to add on other bills.
Well, and as Representative Benavides said, with our cut in how much we have as the General Assembly for our bills, we've been looking at legislation that improves the community that doesn't have a fiscal impact. One of the neat things Colorado does, which not every state does, is with every bill there is a fiscal note. That note indicates how much money is going to be need to be coming out of the cash budget to carry out that law. So, for example, the bill that I started sharing with you this morning, House Bill 1004, which is my bill for veterans, we completely reshaped that bill so that there's a minimal workload impact as opposed to it started with a $75,000 fiscal note. We knew that $75,000 fiscal note, in essence, killed the bill. It wasn't a budget priority right now. So we had to figure out ways that we could still serve our veteran community and work with the university system and the community college system to get to that point without costing a fiscal impact. So it's interesting from the perspective of, okay, a constituent comes to us with a problem, how are we going to solve that problem with no money? I know we have this question at home all the time, right? Okay, we want to take a vacation, but we don't have any money to take that vacation. So what does that vacation look like? And we're having those types of conversations on really critical issues around the state. So if we could open it to questions, I would love to do so.
Please.
I'm here representing the League of Women Voters, and we've noticed a lot of bills coming through this year that down at the bottom they say funding by the marijuana tax. And we know that they can't all be funded. Can you discuss a bit about how much of that can possibly go through?
Yes. So we, the Joint Budget Committee intentionally left the decisions on marijuana, what programs will be funded with marijuana tax, until after the bigger long bill budget discussion. But there are a lot of legislators who are kind of eyeing that source of funds because it's one of the only discretionary sources of funds that we have left that has any money in it to fund programs. There are some legal restrictions on how you can use those funds, and they were actually imposed by Colorado voters, and it was about kind of considering and reducing the impact that legalization of marijuana could have in Colorado. So a lot of the money goes to substance abuse programs. A lot of the money goes to programs that ensure that children do not get into marijuana and that kind of thing. A lot of it goes to the regulation and enforcement of marijuana. And we're having this discussion now because the governor made a request of the Joint Budget Committee to allocate some of those marijuana taxes towards housing, towards affordable housing. That's actually not one of the allowable uses under state law right now. And so for that reason, that request did not get through the Joint Budget Committee, but it's not dead yet because we haven't decided how those marijuana taxes are going to be spent. Many people that I talk to believe that when we legalize marijuana and impose those taxes, that all that money was supposed to go to education. That is not the case, though. If you look at the ballot language, only the first $40 million of the excise tax on marijuana was reserved for school construction, not even operation in the classroom. And so that $40 million's there and available for schools if they have, their boiler breaks down or they want to build a new school. All that money's there for them, but it is a competitive grant program, and the need far outweighs the available source of revenue. So that money's there for them. But there's other marijuana money available with those statutory restrictions. So we're having a conversation about, does it make sense to, broaden the scope of how you can use marijuana, since it is one of the few funds that we have left.
Marijuana dollars.
Marijuana taxes.
If I could add to that there's an interest on one bill that we just passed out of the House yesterday, and that's House Bill 1203 that Representative Lebsack brought. And you may know that a couple of years ago in Adams County, we passed a bill, by vote of the people, to allow the county to assess a marijuana tax. And that was cities sued, and it's an internal dispute in Adams County primarily, even though it impacts all counties around the state. And some cities sued the county, and at the lower court they said the county had the right to do that. At the appellate court said no, the county has no right to tax. It's pending before the Supreme Court right now, so there's no final decision. But this bill would allow the county to tax in unincorporated areas and only tax in municipal areas if there was a intergovernmental agreement on that.
Or no municipal tax.
Right. And so then there will be, when it goes to the Senate, there'll be an amendment offered that will say, well, let the county tax even in the municipal areas and do a share back of 50%. But that is still going. It hasn't been assigned yet to a Senate committee, but it'll be heard in the Senate whether it changes or not or passes. But you might want to keep your eyes peeled for that in the local newspapers. I'm sure it'll be out there because there's a lot of interest in it in Adams.
Right, did you have a question?
What is going to be the impact if the federal government decides to start forcing the marijuana laws, and what is how does that impact our budget? Because
Yeah, great question. If the federal government came in tomorrow and said, hey, sorry, state of Colorado, we don't care what you voted on, we don't care that it's in your state constitution, we're shutting you down, they have the ability to do that legally. That would have a huge implication on what, obviously, like, Colorado has made, this is now a commercial business, right? You see dispensaries all over the place. It's a commercial business. And so the state of Colorado would lose a significant portion of sales tax that's charged, because not only is it the special sales tax that voters approved on marijuana, the 10%, but it's also, we collect 2.9% general sales tax that the state charges on all products from that fund source. And so if it came down and got shut down tomorrow, we would have a huge budget problem.
But it would also cause as you'll be aware of, a huge legal battle between the state and the federal government, because it impacts the 10th Amendment, which says that anything not given in the Constitution to the federal government is left for the states, and there's nothing in the Constitution about marijuana. So we will fight over that. And Colorado is one of the few states that has it in our Constitution as well. So we have a lot more at stake, because it's the federal government coming in through laws, not through the Constitution, saying, you know, we can change your Constitution, or we can ignore your Constitution. So it would be a huge legal battle about how that would be resolved.
Oh, sure.
And then just the amount of information that's been put out there, because right now, in order to have that level 5 come into the state, we need to make sure we have our state ready for that. Smart intersections, the LTE right now, when it comes to Wi-Fi, is level 4. We need level 5, because those vehicles talk to each other, talk to different systems based on that level of communication. So I think the bill that it's being introduced, it's kind of a stripped down version, doesn't have those I'd say cautionary measures or so to make sure that our states are going for, plus the dollars too, because you're going to impact the cities, those people going into our towns, and then without having any kind of law behind that, because most cities are we have our own rules and regulations, home rule. Okay? So that's going to trump us. So that means that just like anything else comes down to the state, we would have to take dollars out to make sure that we're equipped for those vehicles. And right now, we're not ready for that technology. Even though it's coming through, it's coming through rapidly. This is going to happen a lot quicker. So I'd rather see this not go through and then come back next year. And really look at the deep dive of making sure things are taken care of. Because this technology is going to happen, but let's prepare for that.
So there's a bill making its way through the legislature right now that would put some great basic guidelines around the use and testing of autonomous vehicles in Colorado. I signed on to that bill late, so I wasn't involved in the stakeholder work before the bill happened. Senator Owen Hill from Colorado Springs is the main driver behind this, but it sets a basic framework for how autonomous vehicles should be tested in Colorado. This technology is still in development. It is not viable yet. They're testing in different states, and there are companies in Colorado that are developing this technology. Lockheed Martin, Panasonic, all of those companies are involved in starting to develop this technology. And what we wanted to do was create a basic framework in law so that those Colorado companies could test their technology here, that they wouldn't have to ship it out to other states to test it. So the bill, as it stands right now, and it's going over to the House, and they're going to have some additional conversations about what that bill should look like. But it sets some very basic framework for saying that the regulation of autonomous vehicles is a statewide matter of concern, because we didn't want different rules in Boulder versus Commerce City versus Westminster, because that doesn't allow for a level playing field for testing. If a autonomous vehicle, they're testing it, and it's driving down Colfax and all of a sudden it goes into a different city and there's different rules, it doesn't really work. So that was one of the reasons for creating an even playing field across the state of Colorado. The other thing that we did is say that for cities, they can still do rules, they just can't have rules that distinguish autonomous vehicles from human driving vehicles. So they can still do rules, but you can't have separate requirements for the two. So that was another amendment that was added on through the process, and we're going to continue to have discussions. There are many people who are concerned about when this technology is eventually deployed fully, about what the possible job loss implications of that technology are, right? The people who drive on our roads, whether they're taxi drivers or commercial truck drivers, those are very legitimate concerns. And for me, though, this bill was about creating a basic framework, and those considerations need to be addressed. We have to talk about that, but this is very early in the process, and what we wanted was a basic framework and not, putting so many requirements on that the autonomous vehicles can't actually be tested in Colorado. So those other pieces, I think, are still part of the conversation, and I want to talk about, the possible job loss implications of this technology, but it's still very new. And so we have to make sure that we don't put so many requirements on that we close Colorado completely to any testing.
Dominique and Adrian, and you, thank you for timely discussion. I'm going to change tracks just a little bit because, as you know, I am unapologetically concerned with civil rights. And I have always looked at our state subsidizing privatized prisons as an affront to civil rights, because people of black and brown heritage unproportionately make up those beds. So where are we? I think one of the privatized prisons closed. Where are we at with all of that right now in the budget?
Yeah,
or
so
legislative material?
You may have seen this in the news late last year that one of the private prisons in Kit Carson County in Burlington was going to close. That private prison happens to also be the largest employer in that county, and a lot of people were going to lose their jobs. And so what the legislature did last year was they put together a package of $3 million to incentivize that private prison to continue to remain open. I actually voted against that proposal because I generally don't support the privatization of prisons. I think that is a public responsibility. And so I voted against that package. It still went through. But even when we allocated that $3 million as an incentive to keep that prison open, that corporation decided to close that prison anyway. So that $3 million was never spent. It came back into the state budget. We allocated it to certain correctional programs at public correctional facilities, not at private ones. But private prisons, I mean, they are very prevalent in Colorado, and they house a lot of inmates. And I'm not sure if we tried to transition folks out of private prisons tomorrow, we would have to increase the capacity that we have in our public prisons.
And if I could just talk about corrections more globally, a big focus of my work has been the youth correctional system. So one portion, and interesting to note, corrections for adults falls under judiciary, corrections for youth falls under public health, which is where I sit on the public health committee. And one of the challenges that we are having, and this is in our public facilities, is poor treatment of our youth who are in the corrections system. We have a problem on all ends in corrections in Colorado, and a significant focus has been placed on how do we change that system. And as we have been looking at how do we change our corrections system, and again, my focus has been with the youth, but will impact our adult facilities as well. We are looking at our public facilities and at our private facilities to say, okay, what are they doing right? What are we doing wrong? Where do we take some of that and move some of that, etc., so that we can get to a place where we are not disproportionately incarcerating black and brown individuals, where we're not institutionalizing in our correctional facilities those with mental disabilities who really need behavioral health support, not corrections. And we have a much larger conversation at which you would be very welcome at the table. We've been working with the ACLU in particular, specifically around our treatment of our youth in our correctional facilities. And when I talked about the hard decisions that we've had to make, I had a bill that is very dear to me that I had to put on the table because of the amount of money that would cost for this bill. And this bill particularly would say that our youth who ended up in our correctional facilities were failed somewhere down the line before they ever got to our correctional facilities, and would require a fresh individualized education plan, a fresh behavioral health assessment, so that we could actually make a structural plan for their success during their time in incarceration, so that when they get out, not only will they never come back to the correctional system, but they'll be able to continue on with their education, get a good job, start a family, and do the things that we hope all of our children will be able to do. So we're looking at the whole package where, you know, we don't want to disproportionately be giving money into privatized prisons, and we need to look in our own backyard and fix the problems that we have there. I welcome you to the table for these conversations. They're very exciting because we're forward looking and how do we make it better. My dream, which I'm not ashamed to say, is to empty our youth prisons. I don't want our kids in jail. And that will impact what we're doing on the adult level as well, because if our kids aren't in jail, we're going to have fewer adults in jail. We know that that math works.
And if I could add to what Dawn is saying, is that in the Judiciary Committee, the chair of the Judiciary Committee in the House, EP, will be bringing a bill this year. He and others went to visit Missouri juvenile
yeah, we're looking at the Missouri model.
They have a great model that also the corrections people went to. They want to hold off implementing it. He wants to get started on implementing it right away. And so that bill will be heard. There's a lot of issues in corrections beyond just private prisons. We have the average stay of someone in prison is only 4 years, so they come back out in the community. We have a 2,000 number wait list for sexual offenders to receive treatment. So they may be getting out before they ever receive treatment in the facilities. So we have lots of issues. I had hoped to bring a bill to start the renovation of CSP2, the prison we haven't used, and the DRDC, but it would cost $9 or $10 million. So this year we're not going to be able to do it because of the budget. But all those things are on the table and will be looked at. There will be some interim committees looking at those things. But I just wanted to say maybe we could just take one more question, because I know a lot of people need to go to the CD7 reorg, and we were only going to be here till 11:30. So maybe if there's one more question.
One more question?
No?
All right.
Richard?
Richard.
Now that you've made the decision on the Joint Budget Committee, what impact do those decisions have on the negative factor on school districts?
Yeah. So it was
You define the negative factor.
yes. So the negative factor first, if anyone doesn't know what that is back when the Colorado voters passed Amendment 23, it required the legislature to increase education by 1% every single year. At the time, the legislature, it's questionable whether voters meant to only apply that 1% to base per pupil funding, which is the amount that we give to every single school district, or to incorporate all these other factors, things like at-risk students, students that live in poverty, English language learners. All those different factors are additional money that we give to school districts to serve those vulnerable populations. The legislature at the time decided to exclude all those different factors and the money that comes with them, and only apply that 1% increase in funding to the base per pupil amount. So what we did in that is create a negative factor, essentially an IOU, that we wrote to school districts and say, hey, we know we owe you this money, but we don't have the money to give it to you right now, so we're just going to kind of write you an IOU, and every year we're going to keep track of that IOU, and one day we're going to pay it down, but it won't be anytime soon. That IOU has now grown to about $830 million. that we owe to school districts that we just can't afford to give them right now.
For this year alone.
For this year alone, thank you. The Joint Budget Committee did our best to allocate as much money towards education as possible, but still, to balance the budget, we had to allow that negative factor to grow, to increase by $50 million. So it won't be 830 anymore, it'll now be $880 million. We were able to, it was originally going to be 75 million, we were able to get it down to 50. My goal, and I know many of my colleagues in the Senate, at least on the Democratic side, our goal is to get it to zero, to make sure that we are keeping pace for education funding. And we have a variety of amendments that we're going to introduce to the budget to try to get it to zero. But we're really going to try hard to figure this out. The funding for education will still increase, but it's just not going to increase as much as schools really need. I think I saw a figure just the other day that the per pupil number that will increase for next year is about $160. So schools will have $160 more per pupil for the next year than they did this year. But it's still not enough to keep up with the demands for education.
And one of the things with that is that because of the Gallagher Amendment, we are going to have to make up for the counties about $150 million that the state in the past has not had to pay, that will go to the schools. So it's not that the funding's being cut, but it's going to have to come against the Gallagher Amendment. If we didn't have that, then we probably could have even reduced the negative factor. But because of that, we can't.
And if you are unsure about Tabor and Gallagher and all of these words, because we have quite a tax soup, there is a great website for the Colorado Fiscal Institute, spelled FISCAL, that has videos and blogs that really define what all of these things mean and what their impact is for our life. And I recommend that you check them out. Either look up their website or their Facebook page, because they post all of that stuff on their Facebook page as well. Very informative.
So thank you all. We're going to cut the questions.
We'll stick around after.